My name is Susan, and I'm a caregiver for Chesterfield Services.
So did you pass the exam on your first attempt?
Yes, I did.
Okay. What skills, if any, did you miss?
On the skills, we had 5 skills that you're tested on, and on the last skill that I had to do was dentures, and I didn't properly wash my hands at the very end of it. I realized at the end, but I had already ended it. So you do get an opportunity to correct yourself as long as you say you're not finished and you want to correct yourself. But I had not done that, but I still got it right because they had seen, I think, on the other skills that I had performed all the proper hand washing and stuff. So I think they knew that I knew that.
Okay.
So
So what kind of knowledge exam did you take, the written or the oral?
it was written, it was on computer. There's 60 questions total. And they said only 50 of them actually count, and the 10 of them are just random questions that they're do something on. I'm not sure exactly what. But the questions really were just common sense questions, and they're multiple choice. And if you just use your common sense, read through the options, you'll probably figure out almost on every one of them which one's the correct one. And they have like different segments. I mean, they don't break it down into different segments, but they cover like some human behavior. Like they have some questions about, is this a sign of stress? Is this a sign of grief? They have some skills questions. I had one about the dentures. Do you soak them overnight? Was one of the answers, which I believe was the correct answer. But so you'll have something maybe about the dentures and some of the other skills. One was about range of motion. And, do you stop raising the arm when the client starts crying, or do you stop it when they show any sign of pain? This seems like obvious type things.
What 3 skills were you assigned during your skills exam?
I was assigned range of motion, which is the arm raises and abduction, adduction, and the leg raises and extensions, their flexions. And giving medication to the client, that was the second one. And the last one I did was cleaning dentures. And, with the first 2 I did, the gentleman that I was doing the skills with, he was my patient or whatever for the range of motion and meds. But they don't use anybody for the dentures. They just give you a set of dentures, and you have to do what you're supposed to do with those.
Okay.
So,
Do you have any recommendations for future test takers?
I do. I recommend you take the test as soon as possible after taking the training. I had actually had to wait almost 2 months, I guess, before I took it. So I remembered a lot of what I had learned in the class, but I had to do a lot of heavy studying before just to feel comfortable that I was going to be able to pass, especially the skills test. I would recommend using somebody as a patient if you have a friend or a relative that would be willing to do that, or if not, in my case, I made my own dummy, which I had a pillow with a pull-up diaper type of thing. I had pajama bottoms on it and a shirt, so I could, use, like they had arms and do all the things that you need to do for bed, turning them in bed and peri-care and all of that. So that's another option. Study your notes. Those are really important because the teacher, will hit on the hard points, and those were a lot of the common sense and the questions that you're going to get. Just remember, like the thing that they really push in the class is knowing the 5 rights of the patient when it comes to giving them medication. And the teacher gives you that really good acronym of TRAMP and what that means: time, route, amount, medication, person. If you go over those things a couple different times at least while you're giving the medication, you're going to be okay. And really the main thing is making sure you wash your hands properly, washing them before you ever touch the client, and washing them if they ever get dirty during the time that you're with the client. And customer service is huge. So you make sure that you're always asking the client their preferences, what they can do for you during whatever you're doing, because you don't know their abilities, so maybe they can help you with some of it, but not other parts, whether they have any weak sides or affected sides, that type of thing. So really the customer service is huge throughout their skills testing.
Great. Well, thank you very much for your time. I appreciate it.
Sure, no problem.